Hi, okay, so this is the pediatric assessment. I'm going to use the same baby that I used for my baby assessment because this is the only resource I have. So we're just going to pretend this is like a 6-year-old kid. Um, and then obviously in real life, I'm not going to be talking my way through it. I will just be performing and then like engaging with the child and like just be playful with them. So like if it's a young kid, talk about Pokemon or Power Rangers, or if it's a girl, like Barbie dolls, and just be engaged in them like that while I perform it. But for this situation, I am going to just kind of talk my way through it, especially since this is a baby. It's not really a good representation. So in real world, I would start with WIPA. So I would walk in the room. I'd wash my hands. I would introduce myself. Hi, my name is Natasha. I'll be your student nurse today. I would identify that the child is who I'm going to see, either if that's asking the child or asking the parent. I would ask about any allergies, and I would provide privacy in whatever setting that may be. And then I would explain what I'm there to do, so that I'm there for the physical assessment. It won't take too terribly long. So when I walk in, I would want to just assess the child overall, its hygiene. Do I smell anything? Do I see any visible dirt on this child? Um, that's the main thing about hygiene. And then I would also assess the affect, the eye contact. Is this child making eye contact with me as appropriate for age? So when I walk in the room, and say like, hi, they should be looking at me. I'd also monitor the level of consciousness, make sure they're alert, they're awake, responsive. If I bring in toys to the room, which I should, are they reacting to these toys? Are they wanting to engage in that? Are they wanting to grab these toys? So that's their level of consciousness, and they should be completely alert and aware. I would also assess their activity level, whether that be physically doing it right then with toys or games, or even just asking if this kid's old enough. Like, do you play sports? Like, hey, like, what position do you play? And or if I just need to ask the parents about any activity levels, sports they're in, etc. um, I would talk with the mom about behaviors that the kid has at home. If there's anything that she is concerned about, I'd also ask about the kid's eating, the eating patterns. So is this kid eating enough, drinking enough? What is he eating and drinking? Are there any issues with that? That'll be helpful. And then I would jump right into the actual assessment with this child. Like I said, real life, I wouldn't be doing this like this. I would just perform it because this kid's just gonna zone out if I'm just sitting here talking like this. But for this situation, that's what I'm gonna do. Sorry about my dogs in the background. So I would start. I'd put gloves on. I'd start looking through the hair and the head. And mainly, first thing I think of, lice. Looking for lice in the hair, in the scalp, any bumps, rashes, anything like that. While I'm back here, I look behind the ears. They tend to get eczema back there, so do that. I'd also, I do have my pen light here. While I'm at it, so I would pull down and look in the ear for a kid under 3. If they're older than 3, you want to pull up and back. So, and then I'd shine in and look. I'd be looking for any discharge, any occlusions, anything like that. I mean, swimmer's ear, if this kid's old enough to swim, anything like that. I would also look at the kid front on, and I would check to make sure that the top of the ears are in line with the pinna. So I want to make sure the whole face is symmetrical, which in this case, yes, it is. I would also use the pen light. I'd look up the child's nose with that, or see any discharge. I can also tell their breathing with that, if they're nose breathing. With my pen light as well while I have it. It helps to darken the room at this time with kids. You would do the pearl, so I'm checking if the pupils are equal, round, reactive to light, and accommodate. I'd be checking the color of the sclera, the conjunctiva, any discharge. I'd also look in the mouth. So at this point, I'd have like one of those tongue depressors. And then just kind of like play around with them and joke with them and be like, hey, like, let's play like Simon Says, or like something like that, and be like, repeat out, like, do what I do, and say, ah, and then you stick their tongue way out. They say, ah, and just look back there real quick, look in their mouth, look at their teeth, is everything intact, look at their palate, the mucous membranes. That pretty much sums it up. Look back at their tonsils or anything, because kids tend to have swollen tonsils, adenoids, stuff like that. Then I would feel the lymph nodes, which are in here, which is hard to do on a baby. Like I said, so feeling the lymph nodes for any swelling or anything like that. And then to test like the range of motion and stuff like that. If this is a young kid, you could get like a baby toy and just like kind of like play with them with it. Sorry. And just see if they're reaching for this toy and like hold it on opposite sides of them. Are they reaching with both of their arms and their legs? Well, not their legs. Just are they reaching with both of their arms? Are they interacting? Are they trying to move to get to this toy? I would also, I mean, if this is an older kid, then I mean, they're probably going to do what you say. So you can be like, hey, lift your arms up. Can you push me this way? Can you pull me this way? Same thing with the legs. You want to test the lower extremities. So, push, pull. You can even have them, like ask them to do some like funny stuff, really with any younger age, like toddler, preschool, like, can you stand up and kick like you're kicking a soccer ball? Can you squat down like a frog? Anything like that. Then I would go and I'd start feeling the arms, and I'd feel the legs for any abnormalities, tenderness. And with that as well, while I'm doing that, I can do a skin assessment, like their circulation, or do they feel warm, are they dry? Check their skin turgor. The color of their skin, is it appropriate? Do I see any rashes? Because rashes are common in kids, so just check anywhere while you're doing that skin assessment and feeling them. You want to look at their spine as well. So really, if they're just sitting, if it's like a baby or a kid or something, you can just look at their spine while they're sitting. Or if it's an older child, you can have them get up and walk and inspect their gait. Look for a pigeon-toed, and have them do something like keep them interactive. Have them hop, like play hopscotch or skip and jump, just to tell about their gait and their posture and stuff like that. See if there's any issues there. Also, I'm going to want to check their nails, so like the cap refills. So do that with their fingers and their toes. And then I have my stethoscope here, so then you would start doing some simple vital sign stuff. I'm not going to put these in my ears right now, but so I can hear myself think. You're going to listen to the apical heart rate on the kid, and while you're doing this, since you're going to be listening to a full minute, you want to engage with them in some kind of fun conversation, about kids, or like what kids like video games or TV shows or anything like that. So you're going to listen for a full minute, definitely distract them, and then I'm going to do the respirations on the front and the back as you would with a baby, an adult, and you would listen in that Z formation. And each listen, you want to, they need to have a full inhale and exhale on each listen, the front and the back. You want to try to avoid the clavicle if possible, because you're not going to really hear anything there. And then, done with that, you want to check all their pulses as well. So you're going to check their carotid one at a time on each side. You want to check their brachial, which is in their upper forearm here, like on their muscles. You want to do the radials. And on all these pulses that I'm checking, you want to make sure they're even on both sides. That's what we're doing here. You would want to check the femoral, the dorsalis pedis, and the posterior tibial pulses. So the top of the feet and back here by their ankles, if you can see that. That's all the pulses. Like I said, you're checking the evenness on both sides, +2, even, that. And then you would want to check their temperature, preferably auxiliary, so just under their armpit, check their temperature. And then at this time, you can start asking the mom or the parents or whoever's there questions. Does the child have a cough present? If the answer is no, great. If the answer is yes, you want to dig deeper into that. Like, give me the details. Is there any sputum? What color? How much? Stuff like that. And then you'd also want to ask about their urine and their stool. Is this kid voiding as they should? Is this kid pooping as they should? How often? Do they have pain? Can you tell if they're in pain? How many wet diapers do they have a day? Do you notice any blood in their diapers? Anything abnormal? Just make sure everything's normal with that when you're asking the mom questions about that. You'd also want to do the look, listen, and feel to the abdomen. So I would need my stethoscope again. So at this time, I'd lift the kid's shirt up. I would look at the stomach, make sure I don't see any masses or anything like that. And then I would listen to each quadrant around like this. And I would listen until I hear bowel sounds. With kids, you're probably going to hear it pretty quick. If not, you can give them a pacifier, and that'll get those bowel sounds getting more hyperactive in there so you can hear it. And then you would want to feel if the kid's old enough. If they're still a baby, you can't palpate. But at this age, since this is supposed to be a kid, you would be able to feel. So you would palpate, as you should. I would do it with both hands typically, and they'd be lying down for this. And then I would want to really assess the genitals. And I know at kid ages, 5, 6, 7, 8, like, your parents are teaching you to stay away from strangers. Like, if a stranger says don't, sorry, my dog loves this doll. They tell you, if strangers ask you to pull down your pants or see your genitals, like, you say no, like, that's bad. You don't want anybody to do that. So at this point, since it is a necessity for a nurse to kind of look at that area on a kid, you would want to kind of explain to the parents, like, hey, can you, have a discussion with your child real quick and let them know that, it's okay in this situation to let me do this. And that'll really help with this, especially if the parents are doing it. You let the parents know that you're okay with their parenting. It's good that they're teaching them that, but for this situation, we need that. So you would, when you get to that point and it's all okay, you would then inspect the genitals in the rear, look for any discharge, any rashes. If it's a boy, make sure that everything is okay. If they were circumcised, they can have issues with that later in life. If they didn't, just look for anything abnormal on the rear, vaginal, perineal, whatever's going down there. And that's that. And I think that honestly covers the assessment for the kid. Really sucks that we couldn't do this on an actual mannequin even. That would be able to give us a little bit more realistic. This really sucks like this. But I hope this was good enough for this video, CPE. Thanks.